Hello, welcome to COVID-19 Healthcare Digest Episode 4, Data Considerations for Healthcare Organizations During the COVID-19 Public Health Emergency. I'm Sunshine Strong, a manager with Mazas USA in the Data Services, and we'll also be speaking with Jeremy Dean, Director in Management and Technology Services. Today, we'll be going over data issues and the COVID-19 pandemic, how to properly manage our claims data through this pandemic, healthcare systems and data, data sharing and reporting, and then lastly, we'll go over some resources where you can look at the data and information directly from the sources. First, I'd like to hand off our topic to Jeremy Dean to talk about considerations for your data.
Thank you, Sunshine. At a high level, we're seeing quite a few things happening during this pandemic, and there's some lessons to be learned from previous pandemics and incidents that we've seen. And so we're going to talk about some of those. But what you're really seeing here is you have a playing field that's changing on a daily basis and almost in real time for our healthcare organizations. And data is at the forefront, of what they're having to deal with on a day-to-day basis. Also, the systems that are used to manage this healthcare incident are constantly being updated as these rules change and new data needs arise. Also, as we've seen in the news and those in the clinical space are dealing with on a daily basis, the reporting requirements to the state and federal government are changing constantly as new needs arise, and the data needs to be reported faster and more accurately to try to get grips on what's happening right now. Also, we're seeing coordination with new entities and multiple entities at the same time at a scale that we've never encountered before, as we all try to deal with and cope with the changing data landscape of an incident of this proportion. And finally, and not least, the paradigm for how care is given is changing for our healthcare professionals. We are no longer just in hospitals, we're in arenas, we're in hotels, we're in in parks in New York. So the data that's actually being collected during care is changing where it's being collected and how it's being stored, and this creates new data challenges. And all of this is happening in a challenging and rapidly increasing clinical demand for our actual healthcare professionals.
It is a swiftly moving target as we kind of navigate through this pandemic. But Jeremy, I know you and I have both kind of seen prior disaster recoveries through history and know how important it is to be prepared and try to get things going currently now.
Correct. And right at the forefront of that is the financial side of this and the claims data. So moving into that topic, one of the hardest parts that we're seeing right now, and you see it in the news constantly, is hospitals are under an incredible financial burden to handle what is happening with the COVID-19 pandemic. This brings a lot of importance to claim data. One of the things that we'll see is you have encountered data that has prior old, outdated claim codes on it that needs to be updated. And so, as you can see to the right of this slide, there are some information from both the Centers for Medicare and Medicaid Services, along with a prior healthcare digest that was episode 3 that was done by our team that has some great information in it. But Sunshine, I know you've had some experience with claims and the claim codes and the changing codes and also the waiver programs. Hopefully you can speak to some of the things that you've been seeing.
Oh, absolutely. One of the hardest things that I think health plans and providers and hospitals are going to have to deal with is kind of going back and retroactively inputting the new codes that CMS has created specifically for the COVID response. Those are a lot of codes that we didn't have when the pandemic started. So we're really going to have to work around going back and updating that data. And also, a lot of our systems have restrictions and needs for pre-auth that have been eliminated through the enaction of the 1135 waiver. We go over that a lot in episode 3 of this digest, but briefly, the 1135 waiver eliminates a lot of the needs for pre-auths, and it allows individuals who are eligible for Medicare who might not otherwise be eligible to get services. This waiver was enacted by the Presidential Declaration of Disaster and Emergency under the Stafford Act or National Emergencies Act, and the Healthcare Secretary enacts the Public Health Emergency under Section 319 of the Public Health Service Act. And then both of those happen on March 13th. So we are well on our way to be able to enact all of the new codes and waivers that come along with that.
Yeah, this is, to me, where the IT shop and the billing side of the house really can come into play and help with this pandemic and responding to it. Maybe they can't put on scrubs, but as we're seeing, stories in the news of healthcare professionals taking pay cuts and, even things like hospitals not having the liquidity to stay open right now, being able to turn claims around quickly is an incredible asset to these organizations. And some of the things to consider even are, how can intelligent automation speed up claim processing when we have outdated encounter data with these new claim codes? How can you get those processed maybe without them being fully through your own life cycle inside of the billing system? So this is where, again, IT and the data teams and the billing teams can really work together to help the hospitals keep moving forward during a very difficult time, especially as data, again, is being claimed and clinics or clinical services are being rendered in places that they've never seen before. So the claims data is definitely a spot where this has really been impacted, and I think we're seeing new challenges that even past incidents haven't seen before.
There you go. So Jeremy, what does this mean for healthcare applications?
So again, much like we've said throughout this digest, the paradigm of how care is being provided is changing. One of the biggest changes is the healthcare systems themselves are changing again on a rapid basis. We're getting the new claim data that we talked about, but we're also seeing new diagnoses codes. We're seeing new laboratory methods being put into place. So we've got an electronic health record system and other laboratory systems that are changing in real time as these professionals are trying to actually fight this pandemic. So you've got new needs for testing these healthcare systems to make sure these new changes are working, but then you're also deploying healthcare systems in new areas. So again, if we talked about at the beginning, if you're deploying a electronic health record into an arena or a hotel, you've never had healthcare provided there before, you suddenly either have a new wing, quote unquote, to your institution being brought online that needs to be tested, or you have people reverting back to paper. And so you've got to have systems that are where your IT again is coming into play to help get these systems online, tested and ready to go for the healthcare professionals, or you've got to have people that have gone back to paper need to have some sort of system in place to actually be able to scan this paper and get it back into the system. And that's where things like optical character recognition or OCR can come into play. And we're seeing some really cool things done around how you can actually get the handwritten notes into the system quickly, tie it back to the claims that we were just talking about, and then get this stuff processing so that data gets to the state and the federal levels, and these claims get processed so the financial side can be taken care of. And all this is wrapped around patient data, and of course, the requirements of keeping that safe and secure. Obviously, things are loosened right now with what's going on, but this is still very sensitive data. And Sunshine, I know you've worked a lot with patient data. I'm sure you can, understand how we've got to keep this data safe, and I know you've worked in that in some of your previous projects.
Yeah, that's one of the hardest parts of this whole pandemic process is that we have to process claims quickly, we have to get data around quickly, and maintaining all of the secure measures to keep that data private, make sure we're maintaining HIPAA compliance and all of the regulations that go along with all of that privacy data is a challenge. And it's something that takes a lot of time to make sure you're getting right as we're also rapidly changing and updating systems. So it's something that I believe that hospitals and health systems really need to be focusing on. While focusing on this pandemic, we also need to focus on the data and making sure we're keeping those things tight as well. You can't let the security go by just because things are going quick.
Agreed, and this is one of those times that we see a lot of, unfortunately, some nefarious activity from people trying to get at this data. And so we work with organizations to make sure their systems are secure, especially as we're going to talk about in the next section, interfaces between systems and between organizations are more prevalent than ever, that means that data is moving between network systems, and you've got to be able to do that securely. The last thing I would say is, as we've seen in previous incidents, data collection is important right now, but it is what they use to unravel what happened after the incident is over. And proper data collection gives us the understanding of what actually happened and what was done to eventually solve this pandemic that we're facing right now. And so you look at things like Katrina in the past and some of the others, it's that unraveling of what happened that becomes so important, and learning from it and preventing it in the future and preparing organizations for the next one of these. And while we hope they never happen, we know things are going to happen. And it's, proper data collection and what IT can do now to help that data collection that really allows the lessons learned into the future that becomes so important for keeping patients safe going forward.
So how do you think this affects data sharing and reporting?
Oh, it's a great question. And as we talked about, the data sharing and especially the reporting is huge right now. If you're looking at everything from CNN to our state websites, there are constant updates every single day. Earlier, or I guess tail end of March, the Vice President put out some requests to have daily updates for all the laboratories in the United States. A lot of those laboratories are doing it themselves, but if you are a hospital that doesn't have its own connection to one of the main national scale laboratories, you have to report this every single day. This is being done through complex spreadsheets. That is a huge burden on healthcare organizations that are trying to just keep people alive and keep patients moving through their doors. This again is where working with your IT shop is so important, and the rigor around data collection has to be maintained. On top of this, as we've seen in our own backyard here in California, but across the country, data sharing with counties and health plans and other third parties becomes huge. And you've got to have the ability to these interfaces that we just mentioned. They've got to be using standards. They've got to be utilizing secure methods to get this data from the originating organization down to those that are actually delivering the service. Out here, especially, we're seeing the state level departments interacting with the county level organizations to make sure that the patients there are being seen. That data is moving from third-party telehealth phone banks down to those counties to provide the care. There's just a lot of data moving back and forth, and that puts incredible load on the systems doing it, the networks. And that's where, again, IT's just got to be in lockstep with the clinicians to make sure that the services being rendered by these computer systems is available and working properly, because without that, people just don't know what they're dealing with. On top of that, data governance is a topic that personally I'm passionate about, but it's something that can't be in the way right now. As much as it's important to know our sources of truth and understand where our data is going and that kind of stuff, you got to make sure that the IT side of the house can get out of its own way and help move the data, make sure that it stays structured and make sure it stays secure, but not impose so much rigor that we can't get the data where it's supposed to go. And so that's where we've got to, much like the security, there's got to be some loosening of data governance policies and making sure that people can actually use the data right now where it's needed, and get it to the reporting needs that are being requested, and where the data needs to be useful for the governing bodies that are trying to help in these. Hey, Sunshine, I know you've worked a lot of data in your past life, so I'm sure you've seen similar sized data is moving across the wire before as well.
I think one of the key things that health plans and health systems and hospitals really need to be thinking about right now is that all of these pop-up systems, like you mentioned, we're doing hospitals in arenas and we're using spreadsheets, that all of these data elements are disparate. The systems don't necessarily talk to one another. So I think IT needs to really focus on ensuring that all of our systems can kind of speak to one another in the same language. That's going to be one of the most difficult things moving forward, I believe, as we're sort of setting up all of these new reporting structures and new things and requests that the federal and state requirements require for their data in tracking all of this, is that all of our systems are going to need to start to talk to one another in ways that they haven't been until very recently.
I totally agree with that. And I think that, one of the things that we're going to see is, while some of the larger systems that healthcare organizations depend on, such as electronic health record, have great reporting capabilities, we're suddenly outside in a new paradigm that they're not built to maybe report on. And so this is where things like data warehouses and data lakes and things like that become so important, because you're going to need to be able to merge very disparate data sources, like you said, everything from a complex electronic health record down to possibly paper and spreadsheets into one location where this data can be put together and collated in a way that can actually be useful on a bigger scale. And so that's where, again, the IT and the data scientists in your organization can't necessarily put on scrubs, but can be incredibly helpful in understanding what you're facing today, what tomorrow looks like, and making sure that, again, importantly at the tail end of this, how do we unravel this story and understand what these organizations are doing? And again, all this comes back to where we started this conversation with the claims. You've got to have, to get reimbursed, you got to have these claims, you got to have the data. It's going to be coming from different places. And eventually you got to find a way to get these organizations reimbursed for all the great work they're doing to keep people alive in the communities. So it's a lot of data. It's going to take a lot of effort to keep it together, but that's where the IT shop comes in.
Well, thank you, Jeremy. This has been a lot of information that I think is going to be very useful for anybody who's tuning in. I wanted to go over, we do have some resources here to go over the information covered today. This is up to date as of today. This is a swiftly changing topic. Things are changing all the time, so please reach out to the sources to get up-to-date information. Thank you. I'm Sunshine Strong, Manager of Data Services with Mazas USA, and Jeremy Dean is a Director with Management and Technology Consulting. We are here for any questions you may have, and there are a wealth of resources available. Jeremy?
Yeah, I know we covered a lot of topics today and raised a lot of data issues. I want to just point out that there are a lot of solutions out there, and we've got some experience in the vast majority of them. We're seeing everything from intelligent automation to some really interesting front door technology with chatbots and ways to eliminate patients coming through the actual doors of organizations through technology. We're seeing, healthcare testing with the ability to test the tools that are out there. We've got a lot of ways to help organizations that are experiencing these data issues. So please don't be afraid to reach out. We're happy to talk, offer advice, or see how we can help your organization with all that you're facing during this pandemic.
Thank you. And most importantly, Mazas would like to thank all of our healthcare workers for all of the work that you guys are putting in. We really appreciate all of the hard work.